Hello, everyone. It's now 12 o'clock p.m. Eastern Time, and you have joined the Fiscal Year 21 Justice and Mental Health Collaboration Program Category-Specific Orientation webinar. To allow for additional sign-ins past the hour, we will be starting in just a few minutes, so if you've joined, please hold on. Thank you. Hello, everyone. I'm going to cover all of the time zones and say good morning and good afternoon to everyone. Thank you so much for joining today's Fiscal Year 21 Justice and Mental Health Collaboration Program Category-Specific Orientation webinar. My name is Allison Upton, and I am a project manager at the Council of State Governments Justice Center, and I will be moderating today's webinar, which is hosted by the U.S. Department of Justice, the Bureau of Justice Assistance. Next slide. Give you an overview of today's webinar. First, we'll do an introduction of our panelists and provide a brief overview of the Bureau of Justice Assistance, the Council of State Governments Justice Center, and the Justice and Mental Health Collaboration Program, or Jmhcp, as we usually say for short. And then we'll take a look at the group of 2021 Jmhcp awardees and their areas of focus. We're also going to be providing some additional information about the technical assistance process for grantees, including some more specifics about the planning and implementation guide. And next, we're really excited to hear from two Jmhcp grantees who are further along in implementation of their projects. They're going to share information about their work and their experience on the ground. And then towards the end of the webinar, we'll have some time for some questions and answers. And just a couple of housekeeping items as we start out. Anytime during the webinar, excuse me, you can ask a question by clicking on the Q&A button at the bottom of your screen and entering your question. This includes both technical and content related questions. We will try to reply to technical questions in the chat window as we go. And for the content related questions, we will keep a running list and address them at the end of the webinar. We're going to do our best to get through as many questions as possible. If you encounter any technical or audio problems during this webinar, please click on the links that are going to be dropped or have been dropped in the chat box. Please understand that there are some technical issues we may not be able to resolve, but we are going to definitely try to do our best. And we also just wanted to let everyone know that we are recording this webinar, and so we will post it on our website along the session recording along with the slides themselves on our website, ideally by the end of next week. Next slide. Okay, so I'd like to introduce some of our present speakers today. So for introductions, our first speaker is Rachel Lindley, who is the trial court administrator for the Van Buren County Courts Circuit Court and is the official point of contact for the fiscal year 19 Jmhcp Van Buren County, Michigan grant project. Rachel has been employed with Van Buren County Courts since 2016. She started as a specialty courts and pretrial services administrator, supervising mental health court, drug court, swift and sure, sobriety court, and family reunification court. In April 2021, she was promoted to trial court administrator. Rachel has her bachelor's degree in criminal justice, her master's in social work, and a second master's degree in administration of justice. Our next presenter is Jason Jackson, and Jason is a programs coordinator at the Pitt County Sheriff's Office and is also one of the points of contact for the fiscal year 19 Jmhcp County of Pitt, North Carolina grant project. Jason has been in his role as programs coordinator since 2019, and he oversees specialized program development and implementation within the Pitt County Detention Center. He is vice president of the Pitt County Reentry Council and a board member of the Pitt County Coalition on Substance Use. Prior to coming to the Pitt County Sheriff's Office, Jason worked as a community-based substance use treatment counselor, as a correctional officer, and as a criminal justice adjunct instructor in a variety of academic settings. He holds multiple professional licensures, has bachelor's and master's degrees in criminal justice administration, and has nearly completed his PhD in human and social services. Congratulations on that. And last but not least, Molly Plount is the grant and specialized programs administrator at the Pitt County Sheriff's Office as well, and is the official point of contact for the fiscal year 19 Jmhcp County of Pitt, North Carolina grant project. She is an experienced grant manager and also a certified grant writer. Molly is an alumni of East Carolina University with a bachelor's degree in family and community services and a concentration in family science. She is also currently working on her master's degree in human services, specializing in community and social services. And again, I'm Allison Upton. I'm a project manager in the Behavioral Health Division at the Council of State Governments Justice Center. And I oversee parts of the training and technical assistance for Jmhcp grantee programs at our agency. Next slide. So we're also really excited for you to meet our Jmhcp technical assistance team. So we have all the TA coaches here today, and I will let them introduce themselves. So Deirdra, I'll ask you to start us off.
Thanks, Allison. Good morning and good afternoon. My name is Deirdra Assey. I'm a senior policy analyst at the Council of State Governments Justice Center, and I have been working with Jmhcp grantees for about 6 years now.
And I'm Hadley Fitzgerald, also a senior policy analyst here at the Justice Center. I actually work on Allison's team here at the Justice Center as a technical assistance coach for Jmhcp grantees like yourselves from across the country. Coming up on 3 years at the Justice Center, but prior to this, I worked as a social worker for justice-involved individuals, first at the Public Defender's Office in Brooklyn, New York, and then as a co-responder on a pilot NYPD response team. So great to meet you. Looking forward to working with some of you.
Hello, everyone. My name is Ethan Kelly, also a senior policy analyst at the Justice Center. I've been with the Justice Center for about 3 years now. I work on a range of projects from co-response to courts to reentry services. I have a clinical background in doing pretrial services in Connecticut, and also look forward to working with some of you.
Hi, everyone. Welcome. My name is Rachel Lee. I'm also a senior policy analyst here in the Behavioral Health Division. I also have been working with Jmhcp grantees for almost 3 years. And prior to coming to the Justice Center, I worked as a clinician in inpatient and outpatient settings, and also helped to support a large SAMHSA contract that focused on expanding peer services in the field. So I look forward to meeting you all and working with you.
Hi, everyone. My name is Felicia Lopez Wright, and I'm also a senior policy analyst, also coming up on 3 years, and also working on Allison's team in the Behavioral Health Division. I provide technical assistance to Jmhcp and juvenile Jmhcp grantees, and my project work is focused on crisis system enhancements. Prior to joining the CSG Justice Center, I worked as a licensed clinical social worker for about a decade, providing therapeutic mental health services to youth, adults, and families in outpatient, intensive outpatient, school, and crisis settings. So I look forward to getting to know some of you and your projects and working with you to support the success of your grant projects.
Thank you so much. And just thank you to the TA team here and to our grantee presenters for taking the time to come on today. And also to all of the attendees, we're really excited to see so many of you here. And I see that some of you are starting to introduce yourself in the chat. So, feel free to do that. We love to see that. So thank you, everyone. And so next I'm going to, next slide. Next, I'm going to just briefly touch on sort of a brief overview of the Bureau of Justice Assistance, the Council of State Governments Justice Center, and the Justice and Mental Health Collaboration Program. I'll probably go through these slides fairly quickly since you may have seen them on our earlier, larger orientation webinar. So if folks have questions, again, please feel free to just put them into the Q&A box. Next slide. Okay, so first of all, as you all know, the Bureau of Justice Assistance, or BJA for short, is the funder for the Justice and Mental Health Collaboration Program. So on this slide, you can see their mission statement, and it's through their support that we are able to host this webinar and really have the opportunity to work with you throughout the life of your grant award. So we're very grateful for that. Next slide. So just some brief background on the Council of State Governments Justice Center, or CSG Justice Center for short, or sometimes we even just say the Justice Center. But the CSG Justice Center, our agency, is the training and technical assistance provider for all JMHCP grantees. We are a national nonprofit, nonpartisan organization that combines the power of a membership association, representing state officials in all three branches of government with the expertise of a policy and research team focused on assisting others to attain measurable results. So our staff develops research-driven strategies to increase public safety and strengthen communities. Next slide. So this slide just touches describes a bit more about our work style and how we strive to reflect Justice Center core values, which include a commitment to being independent and nonpartisan in every aspect of our work, providing rigorous, trusted, high-quality analysis, developing practical and innovative solutions informed by data and research, promoting collaboration and building consensus, and being inclusive and respectful of diverse views and experiences. Next slide. And of course, you're all familiar with the Justice and Mental Health Collaboration Program, JMHCP. This is your grant award, right? And congratulations again on your awards. This was a very competitive year. So just as a refresher, through the JMHCP, BJA aims to help states, local governments, and tribal organizations improve responses to and outcomes for people with mental health conditions or co-occurring mental health and substance use disorders who come into contact with the criminal justice system. And JMHCP also supports public safety by facilitating collaboration among the criminal justice, juvenile justice, and mental health and substance use disorder treatment systems. Next slide. Okay, so next we are really excited to take a closer look at the fiscal year 21 JMHCP grantee cohort. That's all of you in attendance. So I will hand it off to Hadley for this next part. Hadley. Oh, Hadley, I think
I was muted.
Yeah. I know.
I'll never.
It always happens.
So thank you. This is a sort of a fun slide because we get to see where all of you are from. You've heard about us and BJA. So now we get to the point in the presentation when we get to talk about you a little bit more. So this map represents where all of you are from. The states that are shaded in blue are the sites where there are JMHCP projects happening in this cohort. So that is 23 projects total across 17 states. So as you can see, it spans nearly every region in the country, which is really great to see. I'll be describing on the next few slides each of your projects really briefly, but it is just good to sort of pause and look at the big picture of this slide and understand that you are not alone. You might be watching from your desk. Maybe you're joined by some of your team members in the office. But we just want you to know that you are a cohort, and you'll have opportunities to get to know each other and learn from each other, not only from each other, but also from those who have come before you too. That's all a part of technical assistance. So many of you are doing projects such as mental health courts, which is exciting to see. And as we go through the next few slides, you'll also understand that there's projects that are coming at the same issue of people with behavioral health needs in the justice system from a different angle, and doing projects like starting a pre-arrest diversion program, or establishing a reentry program. So you'll see the variety of programs on the next few slides. So next slide, please. So I'll be going through these one at a time, talking about each project. The left column displays the site that was awarded. Of course, we understand with any JMHCP project that this is a collaboration. So we're not able to list all of the partners there, but just know that these sites are all collaborative. The middle column describes the grant focus, and the right column describes where along the criminal justice continuum the focus of the work might be. So I'm going to go, rather quickly for the sake of time through each of these, but feel free to go ahead and use the chat as I go through. If there's a program element that you really wanted to emphasize or highlight, or something I missed, feel free to go ahead and share that with the group. It's great to see so many of you already taking advantage of the chat feature. All right, so just going in alphabetical order, I'll be starting with Bexar County, Texas. Bexar County will be expanding pre-booking assessments for diversion, and also increasing outpatient and jail-based competency restoration services. The city of Columbus, Ohio will be using their award to expand mental health court for people facing misdemeanor charges, as well as hiring staff, including a peer specialist. The city of Philadelphia, from Pennsylvania, where I'm located actually, is planning to implement a reentry program for people with serious mental illness and co-occurring disorders. And as part of that, they'll be embedding behavioral health navigators. The County of Douglas, Georgia will be implementing a juvenile mental health court, and part of that will be hiring a case manager and a peer specialist. The County of Durham, North Carolina is also expanding a mental health court, as well as other diversion options. And as part of this, they'll be implementing a validated recidivism risk tool. Next slide. Thanks. So next is the County of Lynn, Missouri. They'll be establishing a co-occurring disorders court, and they'll be using a trauma-informed care approach, as well as using mental health first aid training. County of Mecklenburg, North Carolina will be expanding staffing for their recovery and wellness courts, and developing crisis response and ACT teams. County of Onondaga, New York plans to hire a director to implement an outreach team for 911 crisis response for adults, as well as train other local jurisdictions. The County of Pinellas, Florida plans to implement and staff a mental health court, and they'll be counting on the support of their steering committee to accomplish this. And next up is the County of Rockdale, Georgia. Hats off to them. They've actually been awarded 2 JMHCP grants this year, which is wonderful. The first agency that I'll speak to is Rockdale County's Sheriff's Office. They'll be taking the lead on enhancing their programming and reentry services, and that will include hiring deputies as well as practitioners for their jail mental health unit. And they'll also be developing and implementing cross systems training. Next slide. And the Rockdale County Superior Court has also been awarded to increase community capacity for advocacy, wraparound services, as well as hire a coordinator and a peer specialist. Douglas County, Nebraska has been awarded to expand their screening and assessment and treatment for detained youth. and support positive youth development in the community. 15th Judicial District of Louisiana will be expanding their pre-arrest diversion and reentry programs, and that will involve community mental health and wraparound services. Hennepin County, Minnesota will be expanding their behavioral health and wellness clinic project, and that will focus also on issues of equity and competency restoration services. The Judicial Council of California plans to expand the existing Solano County Specialty Court program, and as part of that, they'll be instituting a peer support program. Next slide. The Judiciary of the State of Rhode Island plans to implement a statewide mental health court and hire staff as part of that, and also work on new partnerships for advocacy, peer support, and wraparound services. My Health, My Resources of Tarrant County, Texas plans to expand their mental health bond docket and implement pretrial risk assessment as part of that, as well as hire staff, including bond officers and case managers. The Northwestern Community Service Board of Virginia plans to implement a behavioral health docket. They'll be hiring a case manager, as well as delivering mental health cultural competency training. Region 10 Community Service Board of Virginia plans to expand their mental health court, hire staff, and cover services for non-Medicaid participants. Next slide. The Supreme Court of the state of Illinois plans to fund selected local courts to develop or enhance their diversion practices for people with mental illness or co-occurring disorders. The Texas Department of Criminal Justice plans to develop a case coordination project to meet the needs of veterans under parole supervision, as well as hire a supervisor and human service specialists. The Tulsa County District Attorney of Oklahoma plans to launch a domestic violence diversion initiative. And part of that will look at improving target population identification systems, and they also plan to hire a case manager, a prosecutor, and detective. And last but not least, the University of Alabama plans to implement a financial empowerment program in mental health court settings. As part of this, they'll be conducting a randomized control trial to determine its impact on recidivism. So this is a really exciting group of projects here. Congratulations to you all. And I'll pass it back to Allison.
Yes, thank you so much, Hadley. This is just, it's so fascinating to see the breadth and just, the interesting projects, and we're really excited to start learning more about the work and to working with you all. So thank you very much. Okay. And so next, we're going to spend a little bit of time today talking about some resources that will be available through the Jmhcp technical assistance process, or TA process, as we like to say for short. So next slide. Okay, so as I mentioned earlier, the Council of State Governments Justice Center is the training and technical assistance provider, TA provider, for all Jmhcp grantees, but specifically for the fiscal year 21 Jmhcp grantee teams. And we're really excited to get to start working with you collaboratively. So as a Jmhcp grantee, you will have a variety of training and technical assistance components available to your team throughout the entire active cycle of your grant. So you'll have a TA coach assigned that you'll get to work directly with. That person will be your main point of contact for technical assistance. You have met them, the team here today, so one of these 5 folks. And you will have access to peer learning opportunities, including connection to current and past grantees who are doing similar work or who may have faced similar challenges. You'll have access to a variety of tools to assist with your project, including resources about best practices, training opportunities offered by the Bureau of Justice Assistance, by the Justice Center, our office, as well as other key partners. And you will also have access to experts. So the TA coaches themselves, as you heard from their introductions, have a lot of experience, we have a lot of experience at the table. We have other Justice Center colleagues who also have we also work with external consultants, subject matter experts. So we really can offer a wide range of content knowledge that we can bring to the table to assist you in your work. Next slide. As you can see from this slide, your TA coach is going to be like a central hub for your team, connecting you to resources and activities that will support the planning and implementation of your project. So throughout the entire grant cycle, each team can expect to have monthly calls with your TA coach. And early in the planning phase, you'll be working pretty intensively on the planning and implementation guide, or P&I guide for short, which is one of the grant requirements, and some more on the P&I guide in a minute. But that'll be one heavy piece of your planning process. So we strive to be as individualized as possible through the TA process. So your technical assistance may contain some or many of the components shown in this graphic. So for example, you might have a combination of peer learning, resources, and even a virtual or in-person, fingers crossed, when we get back to travel, in-person site visit. For some grant projects, that may be part of your JMHCP technical assistance. Your TA coach will be responsive to each of your grantee team's unique needs and support you in meeting your project goals, as well as completing the grant requirements. So next, what we'll do is provide an overview of the P&I guide, TA plans, technical assistance plans, and communities of practice, since these are usually popular topics with the grantees. The next slide. Okay, so the planning and implementation guide, or P&I guide for short, was created for a variety of reasons. It was created to really to support grantees in developing and refining their initiatives. It was created to help foster discussion on best practices, to identify considerations for your collaboration, and to help grantee teams work through key decisions and implement potential implementation challenges. The guide is also a great way, excuse me, to understand the status and the progress of your project, to start thinking through and identifying the types of challenges you might encounter. A spoiler alert, every project faces challenges, so that's not unusual. And the P&I guide also can help identify the ways that your TA coach might be able to be most helpful to you in helping to make your project successful. So as you can see on this slide, the P&I guide itself is divided into 7 topical sections. Each section has questions, exercises, and discussion prompts. So the self-assessment questions and exercises are built on evidence-based principles and emerging practices. And each team, as you go through the guide, will be prompted to write short responses, sometimes attach some relevant documents, and really complete exercises and questions for each section. So your answers will really provide insight into your initiative's strengths and also identify areas that you might want to work on improving. And so I'm not going to go through, we don't have the time today to really go through all 7 sections, but just to give you an example with a little more detail, we'll just, I'll just take a look, for example, at section 2, collaborative partnerships. So section 2 of the guide focuses on the development of collaborative partnerships, inviting the team to consider which key partners, which stakeholders will be critical to the initiative, and also to the needs of your participants, whomever you're working with. So it'll invite, the section asks the team to consider which partners are already at the table, which of your stakeholders might need additional outreach to try to engage them, and who will take the lead on that outreach. This section also clarifies the difference between what we refer to as an implementation team and an advisory board. So an implementation team, as we sort of define it in the guide, consists of those individuals who are working directly on the grant project, sort of the day-to-day operations. Or another way to think of it is the implementation team is the group that will be attending the monthly TA calls. And an advisory board, or what's sometimes referred to as a task force or a steering committee, is the interdisciplinary leadership group that is able to provide feedback on the grant project and also discuss larger systems issues. So this advisory group or steering committee, they might already be in existence in your community, and you might be joining into it through your Jmhcp grant project to discuss that work. Or you might be creating this group from scratch, convening it from scratch through your grant process. So in section 2, teams list memberships for both the implementation group and the advisory board and take a closer look at the processes of those, things like information sharing, for example, things that are important between partners and stakeholders. So discussions of this P&I guide. So that's one example, collaborative partnerships. And overall discussion of the P&I guide sections is really a primary focus of TA calls during the planning phase. And your TA coach is there as an important resource to help support your planning processes. A lot of times grant teams collaborate. Well, I shouldn't say a lot of times. Typically grant teams are collaborating across agencies to complete sections of the guide. This is not meant to be an exercise that one person does by themselves. It's definitely a collaborative exercise. So very often teams will work collaboratively to complete sections and then send a section or two to their TA coach for review ahead of the monthly calls. And then these sections will be a focus of discussion on the monthly TA calls themselves to work through questions or challenges or discuss suggested revisions, etc. Other teams prefer to draft like an entire version of the guide and then send that to their TA coach for review and discussion. It's just, different teams have different styles. So your TA coach will be flexible with you as you set up a structure and schedule for the planning process. And another important point I'd like to make about as you work through the guide, the P&I guide, is that your TA coach may also send you additional information on specific topics to complement certain sections. And also for you all, you and your teams, if you see that you would like additional information on specific topics connected to the work or resources on a particular topic, please feel free to let your TA coach know this, and they will assist you in finding those additional resources. Next slide. So the last part of your P&I guide includes questions. Section 7 of the P&I guide includes a couple of questions that will help in the development of your technical assistance plan, or what we call the TA plan for short. So as you're working on that last section, section 7 of the guide, so keep in mind that you've already gone through all the earlier sections. You've really taken a look. You've gone through a lot of the planning process. You've taken a look at many different components of your work project. When you get to this last section on TA plans, it includes questions that will help to develop your technical assistance plan. And so as you get to that section, we'd like you and your team to reflect on any areas of program development where you would be interested in receiving additional technical assistance. And there are many possible topics. I mean, just a couple of examples, like for example, some teams have wanted to work additionally on refining their evaluation plan, or on staff training, or developing a process to be used for case planning, or sometimes many teams would like to discuss sustainability strategies in more depth. So you will work to identify initially some of these areas that you would like to dive deeper in, and then you and your team will work with your TA coach to develop over time to develop a full TA plan that will include goals and action steps to help the grant project move forward, to help you meet all of your grant deliverables on time, and also really importantly to highlight any of the unique aspects of your work. There are a lot of unique projects going on this year and other years as well. So we always like to look for interesting and unique work to highlight to the field. So just a couple of additional points about the TA plans. So again, TA coaches and teams will work collaboratively to identify the needs and goals to work together on throughout the TA process, throughout the life of your grant. Some of the needs, for technical assistance might be identified through working on the P&I guide. Sometimes the grant team themselves, you all might identify some things some goals that you want to work on. And sometimes the TA coach, through their experience in working with grantees, might identify and suggest some goals to work on over time. But whatever way they arise, the important part is that there's a discussion about the needs and goals of the project during those monthly TA calls. And then you use this information together to create like a roadmap of sorts, the TA plan, which can be used as a helpful tool to help move the grant project forward, so that we can just help support you to meet all of the objectives you want to accomplish. So the TA plans are developed collaboratively. Hopefully I made that clear, and reviewed from time to time. It's a living document, right? And it's continuously being updated. And then at times we do share those TA plans with BJA, and TA plans are really just another way that we really try to make our technical assistance process as individualized, responsive, and helpful as possible. So we look forward to working with you on these TA plans and P&I guides, and to hearing your feedback on the process, because we take that feedback really seriously. Okay, next slide. Okay, so as you can see on this next slide, we mentioned this, we touched on this in the earlier larger orientation webinar, but just as a refresher, this year BJA and the CSG Justice Center are really excited to host 5 different communities of practice. And so these are COPs for short. So these communities of practice are smaller, more interactive training events that offer really great opportunities to connect with and learn from peers and experts in the field. So again, just as a refresher for fiscal year 21, this slide shows the 5 different communities of practice that we'll be holding. So the first is an Intercept 0 community of practice, and that will cover community, focusing on community-based support and crisis services. The Intercept 1 community of practice will focus on the role of law enforcement in crisis response and services for people with behavioral health needs. The next community of practice will focus on gender responsive services for women, zeroing in on the specific needs of women with behavioral health needs who are involved in the justice system. And then we'll have a return engagement of the data and information sharing community of practice. This community of practice has been running for several years. Actually, it might be close to 7 years. It's running for at least 4 or 5 years, I believe. So we're excited to have it back again. And they touch on a variety of projects, a variety of topics, including things like how to collect accurate program data, how to use that data, to evaluate your program impact and make quality improvements. They cover a wide range of topics. And then we are also excited to start a new community of practice this year on the topic of the needs of rural communities. Many of you might know through your own experience in your jurisdiction, or just may know from talking with others that, there are definitely certain needs and challenges that rural communities face that are much less prevalent in urban and suburban areas. Things like huge travel distances, maybe fewer treatment providers and other resources, or difficulty accessing them. So this community of practice will really focus on these challenges and other related issues. Next slide. So a few more additional details at this time about the upcoming communities of practice. So these communities of practice will be open to all active Jmhcp grantees. So again, this is just another great way to connect with not only the other grantee teams in your cohort fiscal year 21, but with other earlier awardees as well. So it's a great networking opportunity. Each community practice will have a total of 4 sessions each. They're going to be really interactive and discussion focused in terms of their format. And really the reason for that is, we've learned from doing the communities of practice over the years that the more people are able to, we know everyone's really busy, but at the same time, the more people can put into the learning communities, the more we all get out of it. So it's just really helps to maximize the learning between each other, between all of the grantees, and with the subject matter experts that we partner with. Being interactive is the best, we find gets the most, maximizes the learning opportunity. And so we know you all are busy, but we are really highly recommending that grantee teams attend, sign up for and complete at least one community of practice. So what I mean by that is to attend all 4 sessions of at least one community of practice, because that's really going to give you all the best opportunity to really fully dive into the particular topic that you choose, whatever is the one you think will will match best with your work or your interest areas. I just cannot emphasize enough what a great learning opportunity this is going to be, to have the chance to interact with all these other grant teams and with our national experts, subject matter experts in such a small setting. So really to get to spend that time with folks is just, it's just such a great, phenomenal learning opportunity. We have learning, we have groups that from prior years of communities of practice who are still in touch because they just find the networking to be really helpful. So it's just a great opportunity. So, you know, that's my, I'll stop with my plug, but that's my plug for the communities of practice, and you just really take advantage of this resource, and you will definitely be hearing more details on the dates of the sessions, on, you know, how to go about signing up for them directly from your TA coach in the weeks to come. Okay, next slide. All right, so before we head into the next part of the webinar where we get to, you know, excited to really hear from our grantee presenters, but before we get there, just wanted to mention one additional event that's coming up this summer. So along with BJA, we're really excited to host the 2022 Jmhcp Grantee Convening. This event is going to be held in July, a date to be determined soon, but we do want to at least mention again, because we know you all have busy calendars, that it will be coming up in July. So this is a special training event just for the fiscal year 20 and fiscal year 21 grantee teams. All of your year and the prior year of awardees will be attending. There's going to be a focus on topics connected to your work through Jmhcp. And so this is a virtual session, but a virtual event, I should say. But during the event, the convening, you'll have the chance to attend larger plenary sessions and also smaller breakout topical discussions. Over the years, we've hosted a lot of conferences and convenings, and one of the most consistent pieces of information feedback we get from grant teams is that they love the opportunity to network and connect with other jurisdictions, and, you know, talk about challenges, talk about what's working well, strategize, brainstorm, and make those connections. So this convening will be another great opportunity, not only to connect within your fiscal year 21 cohort, but also connect with all the grant teams from last year, from fiscal year 20 as well. So lots more detail to follow on this convening, but you will hear more about it through your assigned TA coach and probably through our agency generally. But we wanted to mention it today, and we're really excited to see everyone at this event in July. Okay, so next, really excited to shift over into the grantee experience portion of the webinar. And so I will turn things over to Ethan Kelly to introduce our first presenter. Ethan?
Thank you, Allison. So I want to introduce Van Buren County and Rachel Lindley, who's the point of contact. I've been with this grant since it was awarded back in 2019. So been through the process like Allison was talking about with the planning and implementation guide. And I think one thing I'd like to say about technical assistance and some of the work that we like to do is certainly try to highlight grantees and highlight the great work that you all are doing. So I know I've had several grant sites that I've worked with and have made the effort to highlight what they're doing in our briefs that we write. We have a strategy lab that's on our website. And so certainly I want to make people aware that we look to highlight folks as much as possible. And so with that, I'll turn it over to Rachel.
Thank you, Ethan and Allison. So good afternoon, or I guess good morning, depending on where you live. My name is Rachel Lindley, and I'm the Trial Court Administrator for Van Buren County, Michigan, and also the project coordinator for this JMHCP grant. As previously noted, in Van Buren County, we currently have a men's drug court, a women's drug court, a sobriety court, family reunification court, and a juvenile and adult mental health court. We're a fairly rural community with about a population of approximately 75,000 people. So in 2019, we applied for this JMHCP grant to expand and enhance our adult mental health court. A little history about our program is that we became operational, I believe, in 2015, but the program ultimately felt like a replica of our drug court, but just with a different target population. So we applied for this grant to increase program capacity, which would be supported by hiring a dedicated case manager, a clinical liaison through our community mental health, and 2 peer support specialists. We also requested funding for residential treatment and gender-specific DBT and MRT group treatment services. But one of the biggest goals I would say for us was to make our mental health court a standalone program built on the foundations of best practices. So, 3 things I'll quickly touch base on is how this TA process has supported our grant project and, what you can do to get the most out of it, recommendations for the planning process, and any challenges we've faced along the way. So as I previously mentioned, we wanted our mental health court to feel like it was its own standalone program. And I will say the technical assistance process has definitely supported us along that journey. So working alongside our TA coach, Ethan Kelly, we were able to completely revamp our mental health court phases. Again, previously kind of felt like we just had our drug court phases and just plopped mental health court on top of a form. But now our mental health court phases are just really reflective of the needs of the population, and it's definitely more individualized and has more realistic expectations and goals for those who have a SMI diagnosis. We've also revamped our participant manual. But one of our big things is we had a consultation with the ARC alongside Ethan as well, which is an organization that serves people with intellectual and developmental disabilities. We were able to work with our stakeholders and the ARC on a sequential intercept mapping project using the Pathways to Justice model. So as a result of this consultation, I think, we've done so many great things that are just even bigger than mental health court or the grant. We've been able to screen everyone who's detained in our county jail for IDD, as well as start making referrals as necessary. And that just definitely has impacted the program because we've seen an increase of individuals in our mental health court being served that have an intellectual or developmental disability. Prior to receiving this grant and that technical assistance opportunity, we hadn't had one participant in our mental health court where the primary diagnosis was IDD related. Obviously, that's opened the door to a new slew of things that we have to address, such as now that we are targeting that population, how do we best serve them, as their needs are a little different than someone who has an SMI diagnosis. Lastly, we've been able to evaluate the impact of serving the IDD population on a larger scale, and we're currently putting together a stakeholder collaborative to address the needs of this population and how it again affects us all. And now it's part of our countywide strategic plan. I know that technical assistance can be a lot, and they will ask a lot of questions about our programs, what we do, why we do it. And as someone who's worked in specialty courts for quite a while, I know that we have rules and practices in place, sometimes based on things a particular stakeholder may request or local trends, but these are things that aren't necessarily wrapped up in best practices. But I think by sharing this information with the TA provider, it can create some uneasiness and anxiety because you may feel that funding is at stake if we're doing something wrong. But I promise you, it's the most painless process, and the TA provider is only there to help. Since 2019, I've worked together with Ethan in a very collaborative manner on a number of projects, some identified by me, some identified by Ethan. But I believe we've gotten the most out of our TA experience because it's a relationship built on full transparency and honesty. So, just laying it all out there and letting your TA coach know again what you do, why you do it, and I think they can assist from there. I definitely recommend putting a lot of effort into your planning and implementation guide. Again, it was instrumental in helping our program identify areas that we were deficient. It helped prioritize those things for technical assistance, take advantage of everything. One of the first things I did when I received this grant is I joined the data and information sharing learning community for project coordinators. not only was the information very helpful, but I think it helped kind of build my Rolodex and created this network and this partnership with people who are in the same position as me. And, you know, these are people I can bounce ideas off of, you know, and I said, and I've built relationships that I still maintain today. Maintain consistent communication with your TA coach. You know, Ethan and I have a standing monthly meeting that, you know, unless there's a conflict, I definitely try to make sure that that's a priority to attend on a monthly basis. And most importantly to us was capitalizing on the partnerships and making sure that they're an intricate part of the planning process. Our original interagency work group has grown by double over time since the life of this grant, and those different points of views, not just, you know, from the players that automatically come to mind, like the judges and the attorneys and the treatment providers, but bringing in like local nonprofits and our housing department and local pro-social support groups have helped our program grow by leaps and bounds. You know, this wouldn't be a meeting if I didn't talk about the challenge of COVID. So we received this grant in October of 2019, and in April of 2020, everything was shut down due to the pandemic. So quick adjustments and then readjustments and then some more adjustments in regards to program and funding. But again, kind of having the TA coach to help navigate those things and, you know, reprioritize based on the needs of the population during the pandemic. Program sustainability. I recommend you start having this conversation immediately, day one. You get the money, you add staff, you create all these amazing programs, the grant ends, now what? So I think just being able to facilitate that conversation about what we are going to do when JMHCP cuts us off financially is a very, very important conversation. And my last challenge, I would have to say, is there are so many things to address and so little time to address them. So though the 3 years on this grant has flown by, and I feel like there's so much more work for Ethan and I to do, and that's probably not going to happen. So again, just you know, try to get through as much as you can, but realize that, you know, the project doesn't end when the grant ends, and I continue to work on those things. With that, I don't think I have anything else.
Rachel, thank you so much for sharing that information. I'm going to hand it over to Rachel Lee.
Great, thank you. So I'm really excited to introduce the Pitt County team. I've had the pleasure of working with them as their TA coach for over 2 years now. You know, started with the planning and implementation guide, and now, you know, are really working with them as they implement. They have a dedicated team. They have strong buy-in from their stakeholders, and they've also weathered, you know, a lot of different challenges. So I'm just really excited that we have Jason Jackson here and Molly Plout here to speak more to their program and their experience. So I'll hand it to you guys.
I guess so. Good morning, good afternoon, everyone. My name is Jason Jackson, and so I guess I'll start by saying, you know, Rachel Lindsay, Lindley, she pretty much said everything that we needed to say. I can mirror and echo just about everything she stated in terms of her programming. We started off, so I guess I'll give you a brief overview. Our program is called the Sheriff's Heroin Addiction Recovery Program, or SHARP. That's our pilot program. That's what the grant was written for originally, so we can get started addressing individuals who enter the detention center who presented with substance use disorder, co-occurring disorders, or mental health disorders. The program is just designed to, you know, when those individuals come in, we do assessments, and we figure out the best way to provide treatment for these individuals. It was from the grant, my position, actually the program coordinator position was created, and we also were able to pay for a full-time social worker within the detention center from this grant. So throughout the process, we worked very closely with Rachel Lee and through the P&I guide, and she's helped us tremendously determine where we were going, where we were headed, and where we are. I know the P&I guide seems like a lot. Sometimes it can seem overwhelming. You know, we put things in there and Rachel kicks it back to us and says, well, what about this? And then we'll add that to it and give it to her. She'll say, well, what about this? So it can get frustrating at times working with it because you think you know you have the answers in your head, you know what it should look like, but working for her from her end, she was very good at letting us know and helping us through the things that, looking at a larger scale, looking at a larger picture, seeing a bigger picture, of helping us create that sustainability that we need once the grant ends. She was able to make sure we were connected to certain resources that we needed, when we needed help. And we said, well, you know, Rachel, we're stuck here. What do we do next? She's able to reach out to other grantees, other programs, other people in her network that may not even necessarily be grantees, and say, call this person, speak to this person, get some information. And that helped us grow our network and allowed us to work with other people who've already been in the same place or different places than we were, but we were able to collaborate and get to where we needed. Some of the, like Rachel Lindsay explained, some of the biggest challenges that we did face were COVID, or was COVID, still is COVID. Just last month, I mean, we were still working through some COVID issues inside the detention center. So moving people around, adjusting people, and trying to get it where we needed to be, it was kind of difficult because inside the detention center, when we deal with the COVID situation, we have a lot of volunteers. Our program was pretty much run on volunteer help, stakeholders, and people coming in to help us out. So when we have those issues with COVID, it pretty much stops everything from happening. So working through those issues, I think, was the biggest thing, because again, a lot of the volunteers had to stop coming in. We had to rearrange things. And again, jails were not traditionally built for programming in the way we look at it now. Jails were just not for this. They were built to house people and keep them there until they went to court and moved on. So we were able to work through a lot of those challenges. And even looking at the P&I guides, we were able to, with the Intercept model, we were able to find out where we fell in, and what our role was supposed to be, what we wanted it to be, and what it should be, based on what we were trying to accomplish. So working with the TA, working with Rachel was very helpful. Like I said, she gave us a lot of information. She continued to work with us. Our regular monthly calls were productive. Even if we just had everything, even if we felt we had everything under control, we look at her and say, Rachel, you got everything under control, until she asked another question, and then we had to figure that out. But it was good because it challenged us. It kept us challenged and keeps us on our toes. So I appreciate all the work that they put in to help us with it. And I just encourage everyone to, continue to work with the TA. Transparency, again, like you said, is a big issue. Make sure you're just honest. I mean, they're here to help and not here to hurt you. And just make sure that you get the most out of it and the most from it that you possibly can. Molly, do you have anything?
Yes, so everything that Jason said, I'm right there with him. I agree. I actually have kind of a unique, unique experience coming in this, because I have not been here from the beginning. We actually had a different grant manager who started this process and who went through most of it. And I kind of came in toward the start of our year 3. And so just getting the chance to see all of the notes between the technical assistance provider and the grant manager that we had, and getting to have those monthly calls, I could definitely attest to technical assistance being a saving grace for, you as a grantee. It definitely is a saving grace. It's something that at first, when I came into this, I was like, what is technical assistance? But getting to work with Rachel and getting to see everything that she has helped us accomplish, it it is definitely an asset, a tool in your belt. Use your technical assistance provider. That is my best advice to you.
Well, thank you guys so much. And also, I don't know if you had anything to add about just a peer connection with Franklin County to talk more about your MAT. Jason, I don't know if you wanted to add anything there.
Yeah, so one component we did add to the program was the MAT program, Medicaid Assisted Treatment. And Rachel did connect us with Franklin County, and who was far ahead of us when it came to MAT. And they were able to provide a lot of good information as to how MAT should work inside of a jail setting. As we know, there's very little actual data and research on this. It is a fairly new concept inside of a jail setting, inside of a detention setting. So they were able to provide a lot of information because they kind of pioneered it. They took some hits on the chin along the way, and they were able to get up and keep it moving. And they were able to, once we started talking to them, they were kind of explained in a little bit more candid detail about some of their challenges that they've gone through. And that helped us avoid a lot of things that happened to them. We were able to avoid those issues and just kind of skate by it and get to where we are now. Our MAT program now is thriving. We have participants that we know are coming through, they're receiving their medication, and some of them are being inducted. We're doing induction doses now inside the detention center. We're doing maintenance, and we're also individuals who are on MAT in the community. We're able to continue that medication when they enter the detention center. And then they're able to receive the treatment that they need, the therapeutic treatment, the groups, individual counseling. And so now it's just doing great. It's a wonderful program. I think currently right now we have about 36 participants on MAT. That's, including some that have been here for a while and some that come through the door who are going through withdrawal and identify with opioid use disorder. And we just maintain those individuals. Like I said, now this has helped us build a team, build a reentry. We have a reentry specialist, we have the social worker, we have myself, we have another clinician, and we have a peer support specialist who are all in-house inside the detention center full-time, who are able to work with these individuals as soon as they hit the front door. So that is why we're able to focus on so many. 36 for some may sound like a lot, for some may sound like a little, depending on the population size of the detention center. But it's a manageable number for what we have right now. And it's been great. And I think that initial linkage that we had with Franklin County really put us where we needed to be, move us in the right direction when we started our MAT program.
Great, thank you. And actually, if I could just ask one more follow-up along the lines of medication-assisted treatment. Can you speak to how sort of you assist people to continue receiving MAT once they leave the facility?
Absolutely. So you see, guys, how Rachel will ask you questions. She will get you thinking. So what we did was we created a partnership with our community stakeholders. So I advise everyone to make sure you include your community stakeholders, get very good partnerships with them, and very good working relationships with them. So what we do is when we start MAT inside the facility, Port Health Services is a treatment center in our community who has agreed to essentially receive a warm handoff from these individuals as they leave the detention center. So they also provide medication. We have 2 pharmacies that provide our medication, one from our contracted medical provider within the jail, and one from Port Services. So what Port does, they'll provide a bridge medication. So if somebody is released on a Friday and they're receiving MAT, there'll be a bridge prescription for them to last over the weekend until they're able to arrive at Port on Monday to continue their treatment. So essentially, that peer support specialist and one clinician that we have inside the detention center are employed by Port Human Services. So essentially, when they're here, they are already enrolled in the community as a Port patient. So they're being treated here, but the enrollment process starts while they're here. So then when they leave, there's no barriers for them to leave here and walk directly into treatment. Whereas, you know, some treatment centers you walk in and it takes, you know, a whole 8 hours to get enrolled, or they tell you to come back, they'll start a process, it takes a week-long process. Whereas here, they start the process here while they're here and waiting. And when they walk out the door, they go directly to Port and the treatment continues with no break or with no lapse in service. So that helped us out a great deal. And that community, that partnership with that stakeholder and with that community resources is imperative for us to continue our MAT program.
Thank you. And I know, your stakeholder buy-in is extremely helpful and will continue to help you along your lines of sustainability. So thank you so much to the Pitt County team for your time. I'm now going to pass it over to Felicia for Q&A.
Thank you, Rachel. I appreciate that. And thank you so much to Rachel, Lindley, Jason, and Molly for your presentations. It was really great to hear from you. So now we will begin the question and answer portion of the webinar. We will respond to as many questions as possible in the time remaining. As a reminder, you can ask a question by clicking on the Q&A button at the bottom of the screen and entering your question. Also, as we're taking questions, we will advance the remainder of the slides, which have information about the contact information for our panelists today, and how to sign up for the CSG Justice Center newsletter, which we have such great information and resources there as well. So please do sign up. As a reminder, this webinar has been recorded and will be posted along with the slide deck on our Justice Center events page. So if you go on our website and click on resources, you'll see an events tab. And if you click on there, you can see all of our previous webinars and upcoming webinars as well that you can register for. Great. So our first question came in for Rachel Lindley in Van Buren County regarding services for clients with intellectual and developmental disabilities in your system. And the person wanted to know if these services are provided with your state IDD providers. And also another question is if your organization utilizes IDD waivers.
Yes, so we actually work with our Van Buren County Community Mental Health. They have IDD specific services locally. So primarily that's who provides the service. And yes, we have used IDD waivers.
Thank you. And I have another question for Pitt County, actually. Do you provide linkage to accountability court referrals for mental health clients? Do you have a mental health treatment programs involving certified peer specialists, which I know you touched on a little bit, but not sure if you want to address that again.
We do have a mental health court here in Pitt County, and we have a drug court here in Pitt County. So we have a drug treatment court and a mental health court, and we do provide referrals to them. We do communicate. We have an open communication with them. So people who come in and we are providing treatment to who we feel like that some of them may need drug treatment court. And so if they're in our programs, if they're enrolled in our programs, we have a great line of communication between us and the courts where it's usually typically just a phone call and we can say, hey, this individual, we think would be a good fit for drug court, and just send them the name and information, and they'll, take care of the rest of it. And someone will usually come over from the court and meet with them and find out if it's a good fit for them. And if it is, then they'll start the process from there and while they're still here. And so it's a very good linkage, because a lot of times where somebody may be going straight to prison, they may get that second chance to go through drug treatment court and, you know, work through drug treatment court while they're on probation instead of prison. And that can be done through our peer support. So any one of us here can refer someone to drug treatment court. I mean, they work very well with us. So I just wanted to kind of, I mean, there's no one person that'll send them over there or refer them. Anyone here can do a referral for someone they feel like may be a good fit for either mental health court or drug treatment court for that matter.
Thank you. And I'm not sure, Molly, if you had anything that you wanted to add for that.
I think Jason covered it pretty well.
Okay, great.
Thank you.
We've gotten a lot of questions, and thank you both so much. We've gotten a lot of questions actually regarding the financial approval of the planning phase grant funds, and just a lot of questions about that. So Allison, is it okay if I pass it to you to answer some of those questions?
Yes, sure. That's a very popular, understandably a very popular question. And sadly, I wish I had more specific answers for you, but so I think people are asking about their budget approval in particular. I'm guessing, if not, please chat it, you know, put in the question box more, you know, other questions, but I don't know, because we as TA coaches we don't have, so sorry, let me back up a step. So one of the distinctions between the Bureau of Justice Assistance as your funder and our agency, the CSG Justice Center, as your TA provider, is that we do not, you know, BJA, rightfully so, takes the funder-fundee relationship very seriously, and they keep that communication about budgetary and other grant administration issues between the funder and the fundee, and specifically between the funder and the POCs, the people who main points of contact that are officially recognized by BJA. So you would have created, you know, notified when you got your award who the official point of contact would be, or actually maybe when you wrote your proposal. So we do not actually, you actually will hear more about your budget specifics directly than we would. I can say that BJA is working on approving them. Some of the grant projects may have had their budgets approved already, but I think the vast majority do not have their budgets approved yet, and that's not out of the ordinary. It's a time-consuming process on BJA's part. So I just want to, I say that so that people aren't, not to say that you're not concerned about it, but that you aren't thinking you're the only ones. I mean, you're not the only ones. I think probably many of the grantees have not had their budget approvals. I know they're working on it. We have regular calls with BJA, and they discuss how they're working through the process. A lot of times there's information that has to be, you're going to need to give to BJA in order to complete the budget process. And the budget approval process is multi-pronged. Like, so your senior policy advisor, which is, there's so many acronyms, but your SPA, who is your main point of contact at BJA, will be connecting with you either directly through email or also through the Just Grants system, which is a database that you go into to manage all of, one of the main databases you go in to manage your grant. So they will be your senior policy person at your state policy advisor at BJA. You can connect with that person to find out more specifics. And you can also look in Just Grants to find out more specifics. So you want to be looking to see whether there's any outstanding information that you have to provide, because that's one step of the process. And then once you get all of the information given to BJA that they need, then your state policy advisor will send that information on to the budget office at BJA. So it's a multi-pronged process. That's why it does take some time. I'm wondering if the folks, the attendees number one, have access to Just Grants yet. I presume that you do, but if you do not, then you should reach out to your contact at BJA to find out how to set that up, because you're going to need to be able to go into the Just Grants system monitor your budget status and other aspects throughout the life of the grant. So that's one thing. And the other thing I will suggest is, do you know who your state policy advisor is? I believe one should have been assigned to you. It's usually, they do it geographically by state for JMHCP, and that person would have been one of 2 BJA state policy advisors working to assist the JMHCP grantees. It's either a person named Nikisha Love, or the other SPA is named Tammy Lovell. So I don't know, Felicia or Rachel, maybe you can chat out those 2 names and contact emails. That contact information is also in part of our earlier webinar orientation slides for part 2 of our general orientation webinar, but I think that's pending posting on our website. So in the meantime, we could chat out the Nikisha and Tammy's names and email addresses, if you guys would be able to, in the chat box here. And then I would advise you to, oh, thank you so much, Felicia. So I would advise you all to contact BJA directly to ask about your specific budget, and is there anything else you need to provide, and what is the status, is it approved or not? And just a tip, yeah, thank you, Felicia. That's exactly the tip I was going to mention. We can't say this enough. Whenever you email BJA, they're covering numerous grants, and they get many, many emails from, you know, this year's grantees and earlier grantees. So please always include your grant award number in the subject line in any email that you email to BJA, because otherwise it's very difficult for them to figure out who exactly is emailing them. So your grant award number. So I apologize. I wish I had more definitive information, but that's the budgeting processes are handled by BJA, and this is the latest information that we have, is that they're working on the budget approval process. I would just let you know that soon you will be hearing from your TA coach, and which TA coach you'll be working with. We're working to make those assignments over the next 2 to 3 weeks or so. And once you get once we do that on our end, you'll be getting, an email, of course, introducing yourself, connecting with your new TA coach, and that person can also help you with ideas for follow-up. That is also the way that you will, I see that someone asked about the communities of practice and how do you sign up for that. You will also be here. We have to select dates and everything and work all that out so that they're not conflicting between all the 5 communities of practice. So again, we're going to be working on that in the next few weeks. And so you will hear directly from your assigned TA coach much more about the specifics of the communities of practice and how to sign up for those. But I'm glad you're interested. So that's great to hear. So sorry, that was a long-winded answer to a simple question, but the budgets are just, I know it's a little nerve-wracking, but try, you're not alone. You can start, if you're able to, you can start your planning processes, again, our doors are open. Like, we are there to work with you. Once you get your assigned TA coach, we're there to work with you, no matter how long it takes before you get your budget approved, but hopefully it will be soon.
Thank you so much, Allison. I think that question sounds simple, but it's really not that simple of an answer because there's a lot of steps that go into that. So I appreciate you breaking that down. We also have some folks really excited to get started.
Yes.
On the implementation guide. And when
a GAM, sorry to interrupt you, but I see in the chat. So yeah, a GAM, just for folks, if you're not, is an abbreviation, so many acronyms for grant adjustment modification. And that's sometimes that's an administrative process that has to be done in order for the budget to be cleared and approved. So it's a lot. It's a lot to learn. You're not alone. There's a big learning curve, and just, give yourself some amount of time to learn those processes and keep reaching out to your contact person at BJA, Yes.
So we have other questions regarding when will the teams receive their planning and implementation guide. So it's really great to see some excitement around that, starting that process, and you will receive that when you meet your TA coach. So when you get your first email from your assigned TA coach, we will share that with you. As we discussed before, it is a collaborative process, and we'll work with you alongside it. It can seem very intimidating in the beginning when you get this attachment, but don't worry, we're here to support you and work through it with you and with your team as well.
Yeah, and you have up to, a year, right, Felicia, up to a year to do your planning process from when your budget, the official clock starts from when you get your budget officially approved, right? So you all are already actually ahead of the game in that sense, ahead of the schedule. So, so don't worry. And you also don't have to take the full year if you don't need it. We always want people to, there's some flexibility there. We also really, so many times we're all building the plane while we're flying it. And we also just really encourage folks to use this time. I know everyone's raring to go, but use the time to plan properly. It's really worth it in the end, because you're never gonna, none of us are ever gonna, see all the, fix all the bumps in the road, but if you can eliminate majority of them, that will help you. It'll be worth it in the long run. So don't scrimp on the planning, is I guess what I'm trying to say.
And similar to that, there was a question actually about a little bit of concern regarding accelerating the process of engaging with TA, especially for sites that are planning to implement at the end of fiscal year 21 through 22, and concern about having less time for planning. So not sure if you want to kind of break that down a little bit more, and the expectations from BJA and the support we'll provide as TA coaches during that process.
Yeah, I mean, there's always this interplay between what grantees write in there. It's a great question. And what grantees write in their proposals, right? You have this ideal time frame, and then things, administratively can happen. Like, for example, this year, the awards, your awards cycle starts on October 1st, but you didn't receive notification until later. Now you're waiting for the budget. So it's not ideal, but it's not uncommon to have some of these delays. And so your TA coach will support you. We don't want to hold up your implementation, that's for sure. But remember that BJA's expectation is that you have up to a year of planning time from when your budget is officially approved. That's BJA's expectation. So if it takes you longer than what you originally intended, within those parameters, that's okay with, BJA will be understanding of that. Then again, so I think you'll work with your TA coach and potentially with your SPA to see, well, it's one thing to try to take 6 months to plan, but we really can't do it in 3 months. You can only do so much, right? So you don't want, again, I would encourage you not to sacrifice thorough planning for the sake of starting quickly, because in our experience, people can run into a lot of bumps in the road when they do that, right? So BJA will understand that, and the expectation from BJA is that you can take up to 12 months to do your planning processes from the time when your budget's officially approved. I hope that answers the question. And I thank you to folks who are sharing their budget approvals and offering to talk. That is just so generous with your time. We appreciate that. And you're right, you've alluded in the chat to this two-step process, right? Your SPA, Tammy or Nikisha, has to approve and get all the documentation together, and then they send it to the office, the OCFA office. It's the office of the chief financial advisor. It's the financial office of BJ. They have to then officially approve it. So it is a two-step process, and at some point your SPA is just waiting for that financial office to approve it too. But the first step is getting your main contact, your SPA at BJA, either Nikisha or Tammy, to get everything in that you need, make sure everything is in place in terms of the documentation you need for the budget.
Thanks, Allison.
Yeah.
There's a question on who should we include on TA calls?
Oh, that's a great question. I don't know. Maybe I'll ask the TA coach. Felicia, you would know too. But well, so this is the Justice and Mental Health Collaboration program, right, to start with. So you definitely need to include your behavioral health agency or stakeholder representation and your criminal justice representation. So by criminal justice system, that might, depending on the nature of your project, that might be law enforcement, police, police department or sheriff's office. That might be your law enforcement that's overseeing the jail, like in Jason and Molly's situation, right? Or it could be a prosecutor's office, right? It could be parole or probation. So whatever is the nature of your project, you want to include those folks. And then your other key partners that are going to be working, at least to start with, working on your planning process, right? So it depends, some of your team members might not be hired until you get into implementation, but you want to have that core group that's going to be working on the planning processes. So criminal justice, behavioral health. You might also have, depending on the nature of your program, if it's a court project, for example, you might have public defenders, you might have court officers, you might have a judge, you might have, prosecuting attorneys, state's attorneys. You definitely will have your behavioral health provider. If you're, Felicia, I'll ask you to comment since you have an expertise in youth. Are there any youth-specific agencies that you would suggest for some of our youth-focused grantees?
Yeah, specifically schools. Schools tend to be a very big, it's a very big system. So if you can get school representation and also community-based providers that are specifically trained in youth services and youth needs, I think that's really helpful as well.
And some folks will be having an evaluator join their project, and evaluators, are costly and and may only have a smaller piece of a budget for funding. So you have to make some strategic decisions about when to include them in the process, in the whole life of your grant, and when is it going to be based on your budget for them if you have an evaluator. But I would imagine you would want to have them on some of the TEA calls, maybe not all. It depends on your budget for them and their availability. And sometimes, and also the TA, who you include on the TA calls can change over time. Like you probably will add some more people onto your TA calls once you shift into implementation, because you might have hired new folks, right? But at that point, and then maybe some other people will attend less frequently based on their schedule. But to start with, you're going to need all the folks that are going to play a key role in the planning process, and especially also in completing the P&I guide. They need to either attend regularly, or if they're just contributing to some smaller part of the guide, then they can attend as needed. But I would start off with those folks. And you really, listen, this is all of this work, no matter what, whatever Intercept point you are working, whether it's, pre-arrest or post-booking or specialty court or jail and reentry or community, it's always, I shouldn't say it's always a challenge, but one thing that's really important is this behavioral health and criminal justice system collaboration. This is complicated work, as you all know, and if you don't have everyone there that is at the table, to plan properly and to make sure that coordination and collaboration continues to happen through the life of your grant, becomes a huge challenge. So get the behavioral health, at the very least, you want to get the behavioral health and the criminal justice partners together consistently for the planning process.
Exactly. Like you said before, that's the main point of Jmhcp, is getting that collaboration started and strengthened and ongoing to address system gaps. And the planning and implementation guide is a good focusing point. It's a good activity. It's a good event, if you will, to have everyone at the table and inputting. It really should be everyone providing their input and assisting with completing the activities within the planning and implementation guide, which will support that engagement across the different systems. There was a question about what should we do if something about our grant project has changed, which is a great question. I think you addressed a little bit of this earlier, Allison, regarding just grants and BJA and GAMS. But if there's anything about your grant project that has changed, you do need to notify your state policy advisor that was assigned You also may or may not, they will let you know if you may or may not need to complete a grant adjustment modification in Just Grants. There are some changes that you do not have to do a GAM for. There are that you do. The main big change, if there's a point of contact change for the grant, that was the person that has the Just Grants access, whether that be the programmatic point of contact or your financial point of contact, you immediately need to submit a grant adjustment modification to notify BJA of that change, because that is the main way that BJA contacts and communicates with you in your grant project, is through that person's access to Just Grants, if that makes sense. So that person changed, please immediately notify BJA through the grant adjustment modification and via email as well. It's always good to do both and follow up. And once you're assigned a TA coach, you can also include us in those emails as well. We like to support any follow-up efforts. So hopefully that was clear, but not sure if there's any other TA coaches. If Allison, if you want to jump in with anything else I may have missed there, that's an important one to know, like the process for that. So.
I think, Felicia, if I could just add also, I think it can be really helpful to start, if there's any change that you need made for your grant, that's going to change something from the narrative. I think a great place to start is to talk to your TA coach. So bringing it up on a monthly call, or even just sending an email if it's in between a monthly call, just so we're here to kind of understand what change you might be thinking of and offer guidance and just stay in the know.
Right, there's times where BJ actually will follow up with us directly, because we do meet with them monthly as well to review grantee progress. So they may ask us, hey, your grantee XYZ is thinking about this change. We'd like to know more. What's going to be different? And we would like to be able to speak to that and then be informed to your project as well, because that can actually help them understand better and maybe even move along the approval process. I'm not sure about that piece, but it is helpful for us, like Rachel said, and thank you for highlighting that, Rachel. We should really be also informed regarding the progress of the grant and the life of the grant and the journey.
Absolutely, yes. BJ
yes.
will want to know if there are programmatic changes that they've been discussed on TA calls for sure. So yeah, and we're here to help support you and brainstorm ideas. So I know we're at time. We're actually maybe a minute over, but I'll just say one. Was there anything else, Felicia, that you wanted to say, or?
No, I was just gonna say we're at time. I didn't even realize.
Yeah.
So thank you.
So we'll wrap up, but I just really want to highlight to everyone that we also chatted out a link to the BJA online financial guide. This is a really helpful resource in terms of all of the financial and administrative aspects. This is BJA's resource, and this is their guide with their guidance. So I encourage you all to consult that as needed. But I just want to quickly say, again, thank you so much to everyone. Thank you to Rachel Lindley, Jason Jackson, Molly Plount. Thank you so much for taking the time today to come on and talk about your work. We're thrilled to have you, and it's just so great to hear all that you're doing, and thank you so much. And thanks to all the TA coaches and all the grant teams for attending. It was just great to start to work with you, and we look forward to that continued collaboration. And again, we'll be posting the webinar and slides as soon as we can, probably about a week or week and a half. But in the meantime, here's my contact information if anyone has any questions, and you'll also get your TA coach assignment soon. So we look forward to working with you. Thank you so much, everyone, and hope you all have a great rest of your day. Take care. Thank you. Oh, and thanks, Andrea, for facilitating. Take care.